Oh, okay.
Hello everyone, my name is Iman Sya'ema binti Azman from Hayat 1. Okay, so first thing first, I would like to propose a reason for why I chose this title of psychological disorder for my ICT video. Okay, so I want to be a psychologist or specifically a clinical psychologist. It has been my dream and I tend to do some research about some mental disorders or anything related about this. Okay, so the term psychological disorder are famously known as mental disorder or psychiatric disorder. So mental disorder are the pattern of behavioral that impact some or multiple aspects of your life. There are quite a few mental disorders that are well known by most people, which are schizophrenia, PTSD, which post-traumatic disorder, DID, dissociative identity disorder, phobias, and OCD, which obsessive compulsive disorder. And also, I would like to give you some brief knowledge about some treatment approach that can be used to treat most of the psychological disorder. So don't forget to stay until the end and enjoy the knowledge.
2,000 years later.
We'll start with the first psychological disorder, which is PTSD. PTSD is a mental health condition that triggered by a terrifying event, whether a spectator or victim itself. The symptoms of PTSD differ from one patient to another, and that's what we check out in this video. The symptoms of PTSD are generally grouped into 4 types: intrusive memories, avoidance, negative changes in thinking and mood, and changes in physical and emotional reaction. Symptoms can vary over time or vary from person to person. The intrusive memories may include recurring, unwanted, distressing memories of the traumatic event, reliving the traumatic event as if it were happening again, which is flashbacks. Avoidance may include trying to avoid thinking or talking about the traumatic event, avoiding places, activities, or people that remind you of the traumatic event. Negative changes in thinking and mood may include negative thoughts about yourself, other people, or the world, the hopelessness about the future, feeling detached from family and friends, lack of interest in activities you once enjoyed. Change in physical and emotional reaction is being easily startled or frightened, always being on guard for dangers, having trouble sleeping, which is insomnia, and the irritability, angry outbursts, and aggressive behavior. For children 6 years old and younger, signs and symptoms may also include reenacting the traumatic event or aspect of the traumatic event through play, frightening dreams that may or may not include aspect of the traumatic event. The most common medications for psychotic disorders are antipsychotic medications. Nearly all of them work by blocking dopamine, which research shows is overactive in the brains of people with psychotic disorders. Antipsychotic drugs can have an impact within hours, and they can alleviate agitation and confusion within minutes. However, medication for psychotic disorders usually take several weeks to become fully effective. As antipsychotic drugs reach therapeutic levels, they start clearing the most severe symptoms of psychotic disorders. While some people with severe psychotic disorders never experience total relief from these symptoms, many remain completely free of delusional or hallucination as long as they continue taking these medications.